Day one, first check-in. So students are currently practicing the 1 minute exam. They go through a series of 23 points where we're using palpation as an assessment tool to try to gauge what else is going on in the nervous system. I'm going to go check in with the instructors. Okay, they are practicing 1 minute exam. Uh, how would you describe what they're looking for when they're running through these assessment points?
Especially right now, I'm trying to really make sure they're distinguishing right and left. Right, they're not 100% sure what they're looking for because this is a new way of approaching the body. So really, what's different? Right and left. You notice the difference. If you do, okay, well, that's already something to look at. Let's go deeper from there. Um, and they're doing great.
How would you describe what you're palpating for,
Sure.
finding wise?
We're really looking for where the body's holding its protective responses, where the body's not yielding to what we're trying to do. And we're looking in areas that don't typically come up, especially when someone comes in with a complaint. We tend to go right to the area. We're looking at the whole body and how that might be associated with it.
How is that potentially relevant to a case when most therapies model is there's a symptom, there's a diagnosis, and then there's a step up forward. Our model is somewhat different
Mm-hmm.
in that there's other potential information that may be relevant to what you're
Yeah.
finding.
I mean, the big thing we are taught in most schools, like if the shoulder hurts, you go to the shoulder, you treat the shoulder. My question is, and this is what PRRT really gets into, well, yeah, the shoulder hurts there and everybody's worked on the shoulder. Why isn't it better yet? What's going on in the rest of the body that might be holding that pattern in the system, which ultimately affects the output of pain or dysfunction in that area? Um, so it's really taking a more global, more holistic approach to realizing everything is connected. The body's integrated, so anything can affect anything in the body. And if you don't look, you don't know. Um, and that's the 1 minute exam. That's where we start.
Cool. We will check back in later. What are the common questions that happen as they're learning the assessment?
Common questions are just more specific about how to palpate, how to find the landmarks, what we're feeling for, and just getting your hands on it, getting the experience. So it's the nice thing about a hands-on class is you can see what you think you feel and see if other people agree with you or if they feel something different. So you kind of get that immediate feedback. And the live class is really good for that because you get an actual feel for it instead of just trying to figure it out from a book.
We will see you later. Day one lunch break. It's strange that I have to share this, but yeah, people are always surprised that we serve lunch. So we do a catered lunch at our events, and everybody eats together and enjoys lunch together. Dad always used to think that, breaking bread. So it's part of the weekend. We just broke. They got to learn what we call the Primals, which is a collection of techniques that we start level one with. For the viewers at home, how would you describe what they're trying to achieve with the Primals?
What you're trying to achieve with the primals is overall reduction of tension in basically the entire system. You're trying to reduce the overall sympathetic response in the body. So if you can get people out of the fight or flight brain and get them into the relaxed receptive brain, then your work is going to be a lot deeper, a lot faster. And so it's sort of like the initial move towards letting go of pain and letting go of that tension. And it can be pretty effective and it can be pretty global. So you can do some pretty small moves that can have a systemic effect. And so therefore it's going to make your next steps that much better.
Okay, that's a wrap for day one. What do you find to be some of the most common questions that come across on day one when they're just starting to learn this?
I think the key thing, especially with a live class, is that how does this really work? How do we think about it from a big picture? It's not just a technique; it's really a mindset. It's a treatment goal. How do we find the best goal? How do we modify the technique to meet what we're trying to get?
Ben, I wanted to get your take because one of the students was asking how to reinforce this when they send their patients and clients home. The learning experience and the working experience really only starts with the session. So what do you do? What do you tell your students to do to reinforce the work after the session?
Yeah, sure. I mean, that's the big. If you take PERT to its fullest, a lot of what we do is coach and kind of push them forward and empower them to maintain the changes we're looking for. Um, so my answer to that question was, well, work on yourself first, right? Apply this to yourself so you experience. So then you experience it and you know how to. If you you see tangible results, it's much easier to share that with people and to push it forward. Apply.
Rinse and repeat. Apply,
Yeah.
rinse and repeat.
Perfect. Well, it was a fun day one. Always fun. We're gonna let them get some rest for tonight, get some dinner. We'll see you back for day two.